Hi and Assalamualaikum. My name is Zahmira binti Rashdi and I will start the presentation presenting to you about the medical term related to anatomy, disease and procedure. First, we will take a look at medical term related to anatomy. We have alveoli, also known as air sac, a very small crab-like cluster found at the end of each bronchiole. The alveoli are where the exchange of oxygen and carbon dioxide takes place, and each lung contains millions of alveoli. Next, mediastinum. The mediastinum is the middle section of the chest cavity and is located between the lungs. This cavity contains connective tissue and organs, including the heart and its veins and arteries, the esophagus, trachea, bronchi, thymus gland, and lymph nodes. Next, we will take a look at the medical term related to disease. First, we have emphysema. Emphysema is the progressive long-term loss of lung function, usually due to smoking. Emphysema is characterized by a decrease in the total number of alveoli, enlargement of the remaining alveoli, and the progressive destruction of the walls of these remaining alveoli. As we can see in picture A, where alveoli is changes as the disease progresses. As the alveoli destroyed, breathing becomes increasingly rapid, shallow, and difficult. In an effort to compensate for the loss of capacity, the lungs chronically overinflate, and the ribcage stays partially expanded all the time, resulting in a slightly rounded shape called a barrel chest, as we can see at lateral X-ray in picture B. Next, we have asthma. Asthma is a chronic inflammatory disease of the bronchial tubes, often triggered by an allergic reaction. An asthma attack is characterized by episodes of severe breathing difficulty, coughing, and wheezing. The frequency and severity of asthma attacks are influenced by a variety of factors, including allergens, environmental agents, exercise, and infections. Picture A shows the exterior of the airways before an attack, where the muscles are relaxed and the airways are open. Then picture B shows the factors within and surrounding the airways that cause breathing difficulty during an attack. We can see the muscles tighten and the airways fill with mucus. Now we have croup. Croup is an acute respiratory infection in children and infants characterized by obstruction of the larynx, hoarseness, and swelling around the vocal cords, resulting in a barking cough and stridor. Stridor is a harsh, high-pitched sound caused by blockage present when breathing in. Next, we have tuberculosis. Tuberculosis, which is an infectious disease caused by Mycobacterium tuberculosis, usually attacks the lungs. However, it can also affect other parts of the body. Pleurisy and hemoptysis can be symptoms of the tuberculosis in the lungs. Let's move to the medical term related to procedure. Firstly, we have bronchoscopy. Bronchoscopy is the visual examination of the bronchi using a bronchoscope. A bronchoscope is a flexible, fiber optic device that is passed through the nose or mouth and down the airways. It can also be used for operative procedures such as tissue repair or the removal of a foreign object. Next, we have tracheotomy. An emergency tracheotomy is a procedure in which an incision is made into the trachea to gain the access to the airway below a blockage. Lastly, endotracheal intubation is the passage of a tube through the mouth into the trachea to establish or maintain an open airway, especially when a patient must be placed on a ventilator. Intubation is the insertion of a tube, usually for the passage of air or fluids.
Next, I will explain about the upper respiratory tract. The upper respiratory tract consists of the nose, which is known as a nostril, mouth, pharynx, epiglottis, larynx, and trachea. An image shows the structure of the human upper respiratory system. It starts with the nasal cavity in the nose, which extends into the nasopharynx. The frontal sinus is a space located above the nasal cavity, close to the forehead region. The sphenoid sinus is a space located above the roof of the nasal cavity above the throat region. The pharyngeal tonsil is located above the nasopharynx. The oropharynx is opening of the throat into the mouth. The lingual tonsil is located in the oral cavity, while the plantar tonsil is located behind the roof of the oral cavity. The throat extends inferiorly as the larynx of larynx and ends into the vocal cords, which form the upper segment of the trachea. The trachea is the tubular passage through the air is passed down to the lung. It is composed of stack of cartilage rings, which known as tracheal cartilage. The esophagus lies posterior to the trachea. Next is the nose. Air enters the body through the nose and passes through the nasal cavity, which is the interior portion of the nose. The nostrils are the external opening of the nose. The nasal septum is a wall of cartilage that divides the nose into two equal sections. A septum is a wall that separates two chambers. Cilia is a thin hair located just inside the nostril, filter incoming air to remove debris. Mucous membranes line the nose. This specialized tissue also line the digestive, reproductive, and urinary system, as well as other part of the respiratory system. Mucus is a slippery secretion produced by the mucous membrane that protect the lubricates this tissue. In the nose, mucus help moisten, warm, and filter the air as it enters. Notice that mucus and mucus have different spelling. However, they share the same pronunciation. Mucus is a name of the tissue which is come first both anatomically and alveolically. Mucus is a secretion that flows from the tissue. The olfactory receptor are nerve ending that act as receptor for the sense of smell. They are also important to the sense of taste. These receptors are located in a mucous membrane in the upper part of the nasal cavity. Next is the tonsil. The tonsil and adenoid are part of the lymphatic system. They help to protect the body from infection coming through the nose or the mouth. The tonsil, also called a palatine tonsil, that are located at the back of the mouth, also called as nasopharyngeal tonsil, higher up behind the nose and the roof of the mouth. Next is the paranasal sinuses. The paranasal sinuses, which are air-filled cavities lined with mucous membranes, are located in the bones of the skull. A sinus can be a cavity in any organ or tissue. However, the term sinus most commonly refers to paranasal sinuses. The functions of these sinuses are to make the bone of the skull lighter, to help produce sound by giving resonate to the voice, and also to produce mucus to provide lubrication of the tissue of the nasal cavities. The sinuses are connected to the nasal cavity via short ducts. The four pair of paranasal sinuses are located on either side of the nose and are named the bone in which they are located. The first one is the frontal sinuses, located in the frontal bone just above the eyebrow. And infection here can cause severe pain in this area. Next is the sphenoid sinuses, which are located in the sphenoid bone behind the eye and under the pituitary gland, are close to the optic nerve, and the infection here can damage the vision. The next one is the maxillary sinuses, which are the largest of the paranasal sinuses, are located in the maxillary bone under the eyes. An infection in these sinuses can cause pain in the posterior maxillary teeth. Lastly is the ethmoid sinuses, which are located in the ethmoid bones between the nose and the eyes are irregularly shaped air cells that are separated from the orbital eye cavity by only the thin layer of bones. Next is the pharynx. The pharynx, which is commonly known as a throat, receives the air after it passes through the nose and mouth as well as food. Its role in the digestive system. The pharynx is made up of three divisions. The first one is nasopharynx, is posteriorly to the nasal cavity and continues downward to behind the mouth. This portion of the pharynx is used only by the respiratory system for the transport of air and opens into the oropharynx. The next one is the oropharynx. The oropharynx is the portion that visible when looking into the mouth. The oropharynx is shared by the respiratory and digestive system and transport air, food and fluids downward to the laryngopharynx. The third one is the laryngopharynx. The laryngopharynx is also shared by both the respiratory and digestive system. Air, food and fluid continue downwards to the opening of the esophagus and trachea, where air enters the trachea and food and fluids flow into the esophagus. Two images show that the view of the larynx and vocal cords from above. The larynx, also known as the voice box, is a triangular chamber located between the pharynx and the trachea. The larynx is protected and supported by a series of 9 separate cartilages. The thyroid cartilages is the largest, and when enlarged, each projects from the front of the throat and is commonly known as Adam's apple. The larynx contains the vocal cords. During breathing, the cords are separated to let air pass. The image on the left shows that vocal cords open during breathing. During speech, the vocal cords close together and the sound is produced as air is expelled from the lung, causes the cords to vibrate against each other. The image on the right shows that vocal cords vibrate together during speech. Next is the trachea. The role of the trachea is to transport air to and from the lungs. This tube, which is commonly known as windpipe, is located directly in front of esophagus. The trachea is held open by a series of flexible C-shaped cartilage rings that make it possible for the trachea to compress so that food can pass down to the esophagus. The image shows the schematic representation of the trachea, bronchi tree, and alveoli. The trachea is the part of the upper respiratory tract. It is made of the flexible C-shaped cartilage ring stacked along its length. At the lower end, the trachea branches into two large tubes known as the primary bronchi. Each bronchus further divides into multiple branches known as bronchi. The terminal end of each bronchi contains alveoli, which the air sacs resembling small grape-like clusters. The alveoli are where the majority of oxygen and carbon dioxide gas exchange occur.
My name is Nurafika and I will talk about lower respiratory tract that consists of the trachea, the bronchi and the alveoli, which make up the lung. This structure pulls in air from the upper respiratory system, absorb the oxygen and release carbon dioxide in exchange. First, we have a trachea. Trachea is a tube less than an inch in diameter covered by a cartilaginous ring. It extends from the bottom of the larynx down behind the sternum until it branches into a smaller tube. The cartilaginous ring supports the tube of the trachea and prevent it from the overexpanding or from collapse. They are C-shaped with a gap on the posterior side. Second, we have the bronchi. Bronchi are the passageway that bring air in and out of the lungs. The tube of the primary bronchi branch off from the bottom of the trachea. These branches subdivide further into secondary and tertiary bronchi and then into the bronchiole. Last but not least, we have the alveoli. Alveoli are the microscopic air sacs served by the bronchioles. 100 million alveoli exist inside each lung. They are the terminal end of the respiratory tract and the site of the external respiration. It's also being the place of the exchange of gases between the air and the bloodstream. Next, we have the lung. The left lung has two lobes and is slightly smaller in volume than the right. It's curved in at the cardiac nodes to accommodate the heart. The right lung has three lobes and it is slightly shorter because the diaphragm muscles sit higher below it to accommodate the liver.
Hello everyone, my name is Siti Nur Alia binti Muhammad Razi and my metric number is 20231645657. So today I will explain the physiology of the upper respiratory system, exploring its vital roles in respiration, protections, and communications. So, the upper respiratory tract includes the nose, nasal cavity, sinus, pharynx, and larynx. Each part contributes uniquely to our respiratory health and functions. So let's go to the nose and nasal cavity. Nose and nasal cavity are our first line of defense, filtering incoming air with tiny hairs and mucus is to trap the dust and pathogen. It's also preventing them from reaching the lungs. They also play a crucial role in warming and humidifying the air, ensuring it's suitable for the delicate tissues of the lower respiratory tracts. So, additionally, the nasal cavity houses olfactory receptor enabling our sense of smell. Next is the sinus. The sinus are filled with the space that reduces the weight of the skull, making it easier to support. They create mucus which enter the nasal cavity and help with the humidifications and particle filtering. Additionally, sinus improve a vocal resonance, which improve the richness of the quality of our speech. For the pharynx provide a route for the food to enter the esophagus and air to reach the lungs. It is separated into the laryngopharynx, oropharynx, and nasopharynx. The pharynx assists in sound which articulation and has a lymphoid tissue that aid in pathogen detection and defense in addition to its functions in breathing and digesting. Lastly is the larynx. The vocal cords are located in the larynx, sometimes referred to as the voice box. As airflow through this chord, vibrations occur, generating sound for speaking. So, when swallowing, the epiglottis close over the trachea to keep the food and liquid from getting into the airway, which is another protection functions of the larynx. It also is in controlling the amount of air that enters the lungs, promoting health breathing. To sum up, this upper respiratory system plays a vital role in maintaining our sense of smell, warming, and humidifying the air, generating sound, and also shielding the lower airways from any dangers. Its complex structures and functions are essential for good communication as well as respiratory healthcare. That's all from me. Thank you.
My name is Nurana Fatihah Tirah binti Muhammad Ayub and my metric number is 2023135939. I will continue this presentation about physiology of lower respiratory tract. Lower respiratory tract is the second half of the human airways, continuing after the larynx, including the trachea, bronchi, and the respiratory structures within the lungs, which are the bronchioles and alveoli. So now let's talk about the function of trachea in respiratory system. The windpipe, being the link that connects the larynx to the primary bronchi, plays an active part in letting the air travel in and out of the lungs. The inhaled air passes from the nasal and oral cavities through the pharynx, larynx, trachea, and bronchi into the lungs. Similarly, during exhalation, the carbon dioxide rich air travel back from the lungs into the trachea, larynx, and pharynx via the bronchi to be expelled through the nasal and oral cavities. With each inhalation, the trachea expands slightly in length and width, returning to its normal state with each exhalation. The smooth muscle fibers between the tracheal ring ends help the trachea in adjusting its diameter every time. Now let's move on to physiology of bronchi. The main function of the primary bronchi is to carry oxygen, reach the lungs during inhalation, and let carbon dioxide out of the lungs and into the trachea on its way out during exhalation. It is the connection between the rest of the respiratory tract and the lungs. Its cartilaginous walls help in maintaining its shape during breathing, preventing it from collapsing, where the mucous lining along with the cilia keeps any foreign particles like dust from entering the lungs. The smaller tubes of bronchi are assigned to supply specific regions within the lungs. The three secondary outlobar bronchi of the right lung act as a passage for air to the superior, middle, and inferior lobes of the right lung. There are only two secondary bronchi in the left lung, as there are only two lobes to supply the superior and inferior lobes. For the function of tertiary bronchi, it supplies air to the bronchopulmonary segments. There are 10 of bronchopulmonary segments in the right lung, so it has 10 tertiary bronchi, while the left lung has 8 tertiary bronchi to serve each of its 8 bronchopulmonary segments. The small tubes are responsible for letting the inhaled air reach the alveoli through bronchiole, where the exchange of oxygen and carbon dioxide occurs. So now, what is the function of alveoli in the respiratory system? The human body needs oxygen for every important cellular function, and when we inhale, we draw in this essential gas from our environment. But once the air enters the body, the gaseous oxygen needs to reach the bloodstream so it can be sent to each cell in the body. Also, the carbon dioxide produced by the body due to cellular respiration needs to be excreted through the respiratory system, and for that, the carbon dioxide needs to reach the airways from the blood. Both of these are carried out in the alveoli. So, what happens in the alveoli during gas exchange? Every time we breathe in, the inhaled air travels down the pharynx, larynx, and trachea into the bronchi, entering the lungs through the bronchioles to reach the alveoli. The alveoli are adapted for gas exchange with a large surface area, with each alveolus having a one-cell thick wall and numerous capillaries covering it. The oxygen and carbon dioxide exchange in the alveoli occurs in the process of diffusion, where gas moves from a high pressure area to a low pressure one to equalize the air pressure in the two regions without any external force or energy. When the inhaled air reaches the alveoli, the oxygen passes into the blood due to a low pressure of oxygen in them. On the other hand, carbon dioxide passes into the low carbon dioxide pressure region into the alveoli from a high carbon dioxide pressure region in the capillaries. And the last part of the respiratory tract is lungs. The lungs are responsible for inhalation and exhalation, the method in which the body gets oxygen and gets rid of carbon dioxide. When we inhale, the air enters through the nasal cavity, traveling down via the pharynx, larynx, and trachea to enter the lungs via the two primary bronchi. Then it reaches the alveoli, the small air sacs in the lungs where the gas exchange occurs through the bronchioles. The one-cell thick walls of the alveoli have an intricate network of blood capillaries. As the oxygen reaches these alveoli, the blood flowing through the capillaries takes up the oxygen in the method of diffusion occurring across the thin walls of the alveoli, and the capillaries, the process in which a substance moves from an area of low concentration to an area of high concentration. Similarly, the carbon dioxide carried by the blood from the different organs and tissue of the body are absorbed by the alveoli so they can be excreted along with the exhaled air. Thank you, and that's all from me.